40 years of what you're doing.
Sinuses have other functions as well.
The lifestyle coming in, we have been hearing it in every house now.
We breathe 30,000 times in a day,
A lot of allergies have increased.
which we got post-COVID. A beautiful wife punches air.
Hello everyone, welcome back. Namaste. One thing I wanted to mention before we start this podcast or any other episode or any other conversation going ahead. It is an honor being in presence with the doctors sitting here with so many years of experience, much more than decades, and learning about all this information that we have been getting. Today we have with us Dr Sanjeev Dang, an ENT surgeon, specializes in sinus and allergy. First of all, Sanjeev sir, thank you so much for coming here.
It's a pleasure, ma'am.
As I was mentioning, when I learned that 40 years of what you're doing, 40 years of expertise, I think we're in the right seat to learn a lot today about sinuses. That we did have some discussions about sinuses. We keep learning what exactly sinus is, but I was just telling Sanjeev sir about something that he was just trying to explain me as a normal person who has no idea about studies and doctor's terminology, and the way sir was explaining sinus to me, I think I just stopped it right there. I was like, we're going to do that again. What is sinus? Let's start from there first of all.
Sinuses are those parts of our body which God or nature gave us so that we can walk straight, unlike four-legged animals. These are the four cavities and numerous small cavities in our face which make our face lighter. Of course, sinuses have other functions as well, but one of the main functions that nature gave us was to make our head light so that we can keep our head straight. Keeping your head straight is another thing anyway.
Yeah.
So that is the literal thing. So these sinuses, they communicate with the nose. Actually, sinus disease is different from all other diseases in our body, being not actually a disease but a changeover from the normalcy. That is, basically when for any reason these sinuses get blocked, their communication with the nose gets blocked, the disease starts. That is sinusitis.
Okay.
Of course, it is related with allergy, it is related with nasal bone and many other things, even diseases like diabetes and so on and so forth.
So while you mentioned sinusitis, you did briefly explain it. We'd like to understand a little more about earlier. I think we never used to hear sinus problems a lot, but with the lifestyle coming in, we have been hearing it in every house now. If sinusitis is a common problem that is happening a lot nowadays, what exactly, as a normal person, how can we understand that?
I'll give you an analogous example. See, the thing is, we have a house, very clean, nicely built, newly built, and suddenly we have to shift to other place. I go to America and we lock the house completely, which was clean, there was no food, there was no dirt, etc., etc. And 2 years later we come back, open the doors, and what we find?
Dust.
Fungus, rats, which were not there, infection, bacteria, viruses, and so on and so forth. Where did they come from? It was completely locked.
Yeah.
Because when there is no ventilation anywhere, whether it's a house or it's a face or it's nose or it's sinus, the infection will start coming into it.
Okay.
So sinuses, when they lose their communication with the nose and the air which we breathe does not go into the sinuses, then the start of the infection, exactly like a locked 2-year house. Therefore, as I said, it's different from other diseases because the pathophysiology, the infection is different, and therefore treatment also is different.
Okay.
In other infections of the body, stomach infection and low bone infection, we give antibiotics. Here also we give antibiotics, but more important is that we remove that ventilation system which was gone.
Okay.
So when you go to the house, open the house, after 2 years, clean this house. You don't have to kill rats, you don't have to give antibiotics to take care of fungus. Once you ventilate it nicely, it will be all fine.
Okay. So it's something I understood till now is that when you're breathing through the nose and these sinuses are already blocked, that air won't reach the sinuses, and once it's blocked, the infection will start, and that is called sinusitis.
Exactly.
Okay. How do we get to know? Is there any possibility that we can diagnose it ourselves? And
Yes.
what are the symptoms to
The
recognize?
symptoms of sinusitis are that patient usually has nose blockage, has
Okay.
not been able to breathe nicely, properly, fully.
Okay.
Also, patient has headache. It's called sinus headache.
Okay.
More in the morning when the person gets up in the morning after 6 or 7 hours of sleep, he has headache. When he gets up 2 hours later, even without medication, most of the time the headache goes away.
Okay.
That is a typical confirmatory sign that patient has sinusitis. Of course,
Okay.
there could be nasal fluid coming out. It could be, if it is yellowish, it means there is sinusitis. So these are the main symptoms which patient can know himself that he has sinusitis.
Okay. Nowadays, I was just reading that the cases of sinus problems, sinusitis, and a lot of allergies have increased. Do you think, according to a doctor's perspective, yes, it increased over years in last few decades, and also particularly after Corona, has there been a addition to the cases?
Well, the truth is that the sinus and the allergy, they have increased phenomenally in last 2 or 3 decades because of many reasons. I'll just name those. Pollution is one. Our unhealthy lifestyles like smoking is one.
Okay.
Stress is one. And finally, the lower immunity which we got post COVID.
Okay.
Our body's immunity decreased. So all the diseases, whether it is sinus or heart attacks, they have increased because of the poor immunity.
Okay. While we are trying to absorb this information, what are the causes and why is it happening?
There are causes inside our body and there are causes outside our body. Inside our body, if the nose bone is deviated, which can happen because of trauma, cricket ball injuries can
Okay.
happen. When a beautiful wife punches a bad
Another
husband,
very prominent reason.
bad husband. Anyway, the trauma can give rise to a deviated nasal septum, which will block the communication between sinus and the nose, will give rise to sinusitis. These are the inside factors, and of course, immunity, as we discussed, post-corona it has decreased, and there are other body diseases like diabetes which give rise to lower immunity. So these are the inside causes. Outside causes are pollution,
Okay.
smoking. These are the main causes. And of course, if it's a bad hygiene environment like in prisons where viruses and bacteria and fungi they grow, so in very unhealthy suburbs, so this can happen. So these are the outside causes.
When you say the outside causes, yes, of course, if the hygiene is not maintained, that's one reason. But when you say pollution and smoking with the trend of increase in that, do you also mean to say that with time pollution is increasing, the smoking trend is increasing, and sinuses are also going to increase?
Yes.
Like sinus problems are also going to
They are
increase?
likely to increase further
Okay.
because of these three things. And we drink water, other fluids 5 times in a day. We breathe 30,000 times in a day. Now imagine, if we are breathing smoke or we are breathing polluted air
Yeah.
30,000 times in a day, So what will happen to the sinuses? So that is one of the causes, main causes of increasing incidence of sinusitis and allergy.
Before we go ahead, I was just at the back of my mind, I'm just thinking now that if I would have got a teacher like sir, I would have for sure done my doctorate, because the way you are explaining everything so easily and in such an easy breakdown language, this is so easy to understand. Something you mentioned in the very starting, that the symptoms of sinus problem is headache. Now while you're sleeping, you're getting rest, and when you get up you have a headache. What are the causes of that? Why do we get sinus headaches?
See, you have a glass full of water, okay? As long as it is like this, it's fine. The moment you put it like this, the water is, like this. So when we sleep, then sinuses are horizontal, okay? And if there is a communication lag, if there are some fluids, if there is some blockage, that increases. By the time we get up after 6 or 7 hours of sleep, the sinuses which were partially blocked, they are completely blocked. And when they are completely blocked, since that sinus is a space which has air, if it is completely blocked, it will give rise to pressure and headache will come. And 2 hours later, unless the person has very severe sinusitis, if it is mild to moderate sinusitis, even without medication, once he gets up, stands, 2 hours later, that blockage will be all right and headache will partially or completely go away. So that is the cause of the headache, that the space is completely closed and the air pressure is giving rise to headache.
So after getting up, it slowly comes back to its position and normal.
Correct.
Okay. While you also mentioned that with pollution and smoking, stress is another reason for sinus problems.
Yes.
How is that affected?
Stress, by the way, my professors told me every week. When I became professor, I used to tell my students every week that diseases, physical diseases, and treatment of physical diseases by medicines, by operation is only 50%. Rest 50% in all disease of our body is the stress.
Okay.
So is true in sinusitis. When we have stress, the mucosa in the sinuses, it shrinks and closes that thing which would have happened with pollution, with infection, with nasal deviation, and so on and so forth. So even stress can increase and aggravate the existing sinusitis.
Okay. There was another thing that you were mentioning, how sinus and allergy increases and decreases each other's severity. How does that work?
See, allergy, for your information, I'll tell you, in India it is like 20% of us are allergic. It could be food allergy, it could be dust allergy, and so on. In America, which is such a clean country, okay, and Europe, it is 30%. You say, how come? Yes, allergy is not directly related to the hygienic and unhygienic environment. It has so many other causes.
Yeah.
But sinus and allergy are brother and sister. Okay. If the brother cries, sister also does not get sleep, and so on. Whenever we have food allergy or dust mite allergy or fungus allergy, dust goes into our sinuses through the air we breathe in the nose, and it blocks those communication channels between sinus and nose, and sinusitis increases. Other way is also true. With increasing sinusitis, our towards allergy, our problems increase.
Okay.
And therefore they are both are proportionally related to each other, directly related to each other.
Okay.
Whenever a patient has sinusitis, also most of the time has some form of allergy as well. Therefore, when we treat sinusitis by medicines, by antibiotics, by sometimes operation, to open those channels. We also see to it that patient is taken care of his allergy part.
Okay. So if somebody is coming for sinuses or sinus problems, you are going to check them for allergies also,
Exactly.
because they go hand in hand.
Correct.
Now, as you mentioned it to yourself about the treatment and the surgery, how does the treatment goes and what are the complications?
See, sinuses are those parts of our body which are, directly related, very closely related to eyes, to nose, and even to brain.
Yeah.
Therefore, any problem occurring there and increasing there can give rise to problems elsewhere, particularly in close organs. The treatment of sinusitis is number one. As I said before, I'll repeat it, to rectify the altered physiology. This is a medical term, to rectify the change of state. For example, the house was closed, now you open it.
Yeah.
Okay? And if the nose deviation is there, nasal septum deviation, so correct the deviation. And tell your wife, that person's wife, that don't hit me again, I've corrected the nose septum.
Another treatment.
Another treatment. And of course, in moderate and severe infections, we have to start with nasal douching, which is called jal neti. It's a very age-old practice.
Yeah, it's an Ayurvedic.
Ayurvedic jal neti is a good
Yes.
thing. We practice jal neti in the form of FES, that's a operation,
Okay.
functional endoscopic sinus surgery. So in early, very mild cases, we try to treat allergy and try to change the altered change, that is the change which has caused the sinusitis, like septal deviation. In moderate and severe, we try to treat with the help of antibiotics, with the help of surgery, and of course along with that treating the allergy part.
Any particular surgeries that you would mention if somebody is having a severe sinus problem?
Yeah, two surgeries are mainly required for this. As I said, septal surgery. If the septal deviation is there, which has given rise to this sinusitis, we correct. It's a very simple surgery,
Okay.
septal surgery, septoplasty. And the second is the FES, functional endoscopic sinus surgery. In moderate and severe cases where all the sinuses are blocked, they are, diseased. So we try to remove some of those sinuses and clean the remaining sinuses.
While we talked about the treatment, we talked about the surgery. One thing we want to understand, actually two. One is how can we prevent it other than the hygiene, and second, something if you can throw a light on little home remedies that you can start with if you feel that you have symptoms.
Sure. We can definitely prevent it if we can prevent the pollution around.
Okay.
We can definitely prevent it if we don't smoke, or if we don't have passive smoking, if somebody else is smoking in our house or in our office, etc. We can definitely prevent it by doing exercise, which helps in all other diseases as well.
Okay.
Our sedentary lifestyle will increase our sinusitis. We can definitely prevent it by increasing our intake of fruits.
Okay.
And 45 minutes of exercise. Even home remedies like nasal breathing, Om Vilom.
Yeah.
Nasal breathing 5 minutes morning and evening will help to a large extent to open those communication channels which were the basic cause of the disease.
Okay. Quite interesting. I think with the severity of as small as but a very important part of our body, sinuses, we can prevent it. We can take the measures much beforehand, as mentioned. I think all of us would agree that prevention is better than cure. So let's take the precautions. Let's keep ourselves healthy. And with that, ladies and gentlemen, we have with us Dr. Sanjeev Dang. If you want to reach out, you can get on to the Apollo Spectra helpline and you will get in touch with him. With that, thank you so much everyone for watching and joining in. Please like, please subscribe so you can keep getting the updates about the new episodes that we keep getting, and with a lot of information from the experts. I hope that you'll keep watching and keep being with us. Thank you everyone for being here.